When you suffer from snoring and/or obstructive sleep apnea, an elongated palate and/or uvula may cause your airway to collapse. This, along with nasal airflow turbulence in most cases, which may cause you to snore or worse, to stop breathing completely, causing you to gasp for air and lowering your body's oxygen level. With a customized procedure called minimally invasive palatal stiffening, or MIPS, Dr. Mandel uses a precise diode laser to penetrate the palatal surface of the uvula and soft palate to correct the area of obstruction. As the palate heals, it raises and stiffens, relieving the airway collapse while you are sleeping. A minimally invasive nasal procedure is often utilized to minimize turbulent airflow behind the palate at the same time.